Bum, 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 it's the show and shit. Like, seriously, I need to work on like a. I really need to work on like an intro or something. I don't know. I'm trying to make things a little more professional, I guess you'd say. You know, get a little. See, autofocus is doing its job. Okay. Well, first off, as you can potentially tell, I am using a new camera. A little bit of an upgrade. Well, kind of. I had the camera. I was using a little piece of crap webcam, but upgraded to this new improvement. Hang on. Damn it. Just a second. I keep forgetting to turn down my computer fans. Alright, we'll see how that works. But anyway, yeah. Got some little new equipment, little HD capture card thing, so now I can use an actual camera instead of the webcam. So now, hope with any luck, you can now more clearly and in higher definition see that I'm recording these in my fucking bedroom. Oh well, yeah. Baby steps. Okay, now, I want to do a little update on sort of the status or the state of our healthcare going forward as Americans. And today, Thursday, was the day that they were GOP had scheduled a vote for Trump Care or the AHCA, whatever. And so far, the reports that I've seen so far have said that that will not be happening today. That they will be pushing it either sometime late tonight, some say. Others say, at very least, that they're pushing for a early Friday vote. Which sucks because I'm working tomorrow, and I would love to be able to, like, I don't know, maybe live stream the shit show that's I'm positive will happen. Mainly because I figure, mainly so I figure so that, I wouldn't be releasing a 2-minute video, and that's with the bullshitting at the beginning. Go a little more in depth as to what's going on, what the current status of the bill is. And I'm sorry if I'm not looking into the camera because there's like the little screen off to the side, and it keeps distracting me. I end up looking into the screen. Again, work in progress. Okay. I'll give you a little update as to what's going on. Now, in a previous video, I mentioned that in an effort to get the true right-wing crazies on board, Paul Ryan and others in the House were considering making concessions and dropping certain requirements to make the bill even more of a rollback to what we had before the Affordable Care Act. And that has been confirmed. Let's see. Basically what they agreed to was to basically gut the essential health benefits rule. Now that is the component of the Affordable Care Act that actually requires certain standards, like certain types of care. Now, oh wait, here we go. Now here are some of the areas where basically the essential what was it called again? Okay, the essential health benefits rule basically covers sort of 10 general areas of medicine, and for a plan to qualify for the Affordable Care Act, so individual plans on the marketplace, small groups. I think there were a couple of exemptions, but for the most part, the vast majority of plans to qualify for the marketplace and to be compliant with the Affordable Care Act had to one, offer coverage for all 10 of these categories, which are ambulatory patient services, emergency services, hospitalization, mental health and substance abuse disorders / behavioral health treatment, maternity and newborn care, prescription drugs, rehab and rehabilitative services and devices, laboratory services, preventative and wellness services, and chronic disease management, and pediatric services, including oral and vision care. And in addition to that, having to cover those 10 treatments in those 10 sort of areas, they also were required to remove lifetime caps, which basically was a thing that is a particularly shitty thing that insurance companies would do. So let me break down how that would work, sort of pre-Affordable Care Act, which is what a lot of basically like the Freedom Caucus, air quotes are warranted, in the House wants, is basically they just want a full repeal. And so really, okay, they're just going for full repeal. And so let me, just in case some of you don't remember the bad old days, let me go over some of the things that, kind of go over how this all fits together in ways that screw over people covered by healthcare or health insurance that they paid a pretty good amount of money for. So, essentially what they're doing, or what it is, before the Affordable Care Act, you could get insurance that it might not, most of them did, but it might not cover emergency services. Like if you got in a car accident and you had to have an ambulance take you to a hospital, it might not cover it. It might not cover hospitalization. I mean, it was more likely, I guess, that there are plans that would cover that, but nothing else. But that's a potential thing. It might not cover cancer treatment. Actually, from what I read, a lot of plans actually did not cover maternity care. So, which I'm not even sure exactly what all that would cover. Like, I guess basically if you... shit, I don't know. Like, not cover a childbirth or something? Like, you're just gonna have to pay for it yourself. But, anyway, neighbors are moving around. But anyway, there are a lot of those areas where it wouldn't even cover. And that's the thing, too. People always say, well, like, oh, well, you just get... that's just the plan that's offered there, or just have to get a plan that does offer it. Well, see, and that's an area, too, that I think people either ignore or maybe some have forgotten about. That say, like, oh, well, you have the freedom, you just get the plan that covers your needs. Well, see, here's the thing, like, when you go to work for a place, that's where most people got their insurance, because buying it, just going to Blue Cross Blue Shield or something and saying, hey, I want to buy insurance, it was incredibly expensive. So most people would get covered through their job. And the employers got like one, maybe some of the bigger places, they might offer like a couple, like a nicer plan and a cheaper plan. But other than that, you're stuck. Like you get what they offer you. And if you don't like it, then you're just going to have to find another job. And I know that's something that a lot of people on the right like to say, oh, well, that's freedom. And, if that doesn't work for you, just go work someplace else. Well, in a lot of cases, that's not a fucking option. There are a lot of situations where you don't have the option to just, oh, well, I'll just go work someplace else. But anyway, a lot of times, too, like, that's what you got's what you got, and you can't really afford anything else, so where was I? Okay, yeah, so there are the chances that if you got sick with something or had a certain kind of ailment, it wouldn't even be covered because, oh, well, we're health insurance, but, man, we just don't really want to cover that particular area of your health. And again, that's one of those, that's the deep down kind of nuts and bolts thing of the Affordable Care Act that people don't think about very much, or it's not a very popular thing that people think of. Especially when, you talk about like, oh, well, my premiums jumped. Well, also, too, you got more coverage. Because, I was a kid, but I was involved in a lot of more grown-up things as far as running the family, and insurance, taking care of insurance, things like that, before the Affordable Care Act went into effect. And yeah, there were a lot of situations where, like, I think, there were a lot of cases I worked at Walmart as my very first like official full-time job was at Walmart for one Christmas. And the insurance there, for one, you couldn't get it until after 90 days, which is annoying. Secondly, it was fairly expensive, especially considering that you're getting paid like $8 an hour. And in addition to that, it was weird. Like, it didn't, it was shit. Like, it didn't cover that much. It's like, it was good. According to my doctor, at the time, they said essentially that coverage was good for, like, it covered going to the doctor, getting a checkup, getting a steroid shot or something like that for allergies, things like that, like minor kind of stuff. And then it covered like catastrophic things. But it didn't really cover anything in between. So if so basically a lot of the things that were sort of between this hurts when I do this and freaking cancer, a lot of stuff in between there kind of fell through the cracks. And it was, and that was a plan that it was difficult for freaking representatives of doctors' offices, people who do that job for a living. It was a hassle for even them to figure out what all was going on and how to work the plan to get the treatment put through. So there's a lot of those little kind of minor, like, in the background, people don't think of them that much, things that the Affordable Care Act did that were very good, that helped to bring up the standards of private insurance plans everywhere. So there was that. All right, confusing plans that were already pricey for what you got and for what you're getting paid. Didn't cover everything. Insurance companies could choose what they did and didn't want to cover, or if they wanted to cover you at all. And in addition to that, there was lifetime caps. Lifetime caps were like an additional little gotcha that they slip into your plan, or used to before the Affordable Care Act prohibited them from doing it, which basically said, you pay us a lot of your hard-earned money for this plan, and what you have is actually covered, but we really don't want to spend too much on it. So I mean, basically, hey, we wouldn't want us, the billion-dollar corporation, to miss our fourth quarter profit projections just because you want to keep breathing. I mean, come on, be reasonable. Be reasonable. Just because you got cancer doesn't mean that we should have to lose out on profit. And that's basically what it was. It was a thing saying, okay, we will cover. Again, cancer's an easy one because it's a drawn out treatment process. It takes a while and it's expensive. So let's say cancer. Say that the Maxil covers $150,000 or $250,000, which, when you start getting involved with the high end, like heavy duty medical treatments available in this country, it is not hard to blow through $250,000. So say they put it at that limit. So now, for as long as you have your policy, that's the maximum amount that they're going to spend on treating that type of illness. So, if you come down with that illness and you're treated and you recover and you haven't hit that cap, great. But it still counts if that ever happens again. So, for instance, if you have cancer, you get treated for it, it goes into remission. It costs about $100,000 to treat, and it goes into remission, and you're cleared and everything. fine, they'll cover it. But for as long as you have that policy, if you have that cancer again, well then now if your cap was 250, now you've only got 150 left. So, and that is, in some cases, that was the lifetime, like the lifetime of the policy. If that condition, if you had it now, it went into remission, treatment worked, you got rid of it, a few years later it happened again. Again, once that, it still counts. They don't reset the counter on how much they're going to spend on it. That is total for the life of the policy. Like, we're not paying anymore. Like, yeah, this is like the only ailment that you have, that why you need the insurance, but yeah, we spent too much. We're not going to, fuck off, go die. And that's what they are willing to do. That's what, if there's any doubt in your mind as to the priorities of people like Paul Ryan and Mitch McConnell, again, I pick them out because honestly, let's be honest, they kind of put their face out there as being the House and Senate majority leaders. So yeah, they're sort of fuck it. You know what? Shit rolls downhill, and uphill depending on the. Never mind. That's a bad analogy with a lot of flaws. But anyway, I'm just gonna use Ryan because since he's been the main driving force behind this plan this week's plan to fuck over the voters. But anyway, if there's any doubt left in your mind as to how little they care about the people they're supposed to represent, this should take care of that. Because basically what has happened is that they put out this plan, this idea, this plan for their reform that's going to be better than the Affordable Care Act, and save people on premiums and cover everyone, even though the even though the CBO came out and said no, it's not going to do that. It's going to cut like 20 some odd million people off of coverage over the next 10 years. They didn't care about that. They didn't want to change that. They want to keep pushing forward. And then, when they have trouble getting the votes, they just bend over and grab their ankles for the even farther right wing of the Republican Party and decide, okay, hey, we'll let insurance companies sell policies that don't cover maternity care, or don't cover cancer, or don't cover emergency care. We'll let insurance companies sell policies that have lifetime caps again. There's even some of them that went so far. There's an article in Politico that I will, of course, put in the link in the descriptions. There's some that even so far, even after saying that they're going to gut the essential coverage rule, that they wanted to go further, and they wanted to get rid of the provision that lets kids stay on their parents' insurance till age 26, and they also wanted to get rid of the exclusion on pre-existing conditions. So basically, I mean, at that point, where the hell are we? We're right back where we fucking started. Pretty much. I mean, you got a couple years until Medicaid peters out, and then we're back exactly where we were before the Affordable Care Act was implemented at all. And they were just perfectly fine. Like, okay, fine, we'll cave, we'll give you this. Did they want to move in the more moderate direction? To get the people that are on the other side of that saying, oh, hey, we actually like a lot of this coverage that you're trying to cut. We want it kept, or we're not voting for it. No, fuck them. They went hard right. And wanted to cut it even further. Like, it's just, the fact that this is going on, honestly, is at all, like, that this is acceptable behavior for a public elected official is, to me, is disgusting. Like, I mean, honestly, it's been 10 years. 10, 9, 10, over 10 years, I think. No, about 10 years. Ish. Yeah, or so, since Michael Moore put out the movie Sicko. Go and watch it again. Just to get reminded of the way things were before the Affordable Care Act. Because that's where we're headed. We're if these people actually get their way. Now keep that in mind too. The only reason that this hasn't been voted on in the House so far today, it might be tomorrow, depending, is because because the people who held it up and said no, the majority of them wanted it to cut even deeper, wanted it to remove even more coverage than it already does. And by the way, does Paul Ryan say, okay, we'll make these cuts, but we need to put off the vote and let the CBO run through it again? Oh, hell no. He was perfectly fine with putting those cuts in and cutting back coverage and requirements even further and still wanting to ram it through today. It is just, again, the fact that we're having this kind of discussion, like this is what's going on, is disgusting. I mean, we're not talking about someone getting some representative getting kickbacks for, your standard Washington corruption kind of bullshit. Pork barrel spending and whatnot. We're talking about people who are going to lose their coverage, who are going to go to the hospital or get diagnosed with cancer, or going to have a child, and their insurance is not going to cover it. And they're still, even though they have health care, even though they pay for it month after month, it's still not going to cover them. And in addition to that, now, wheelies have that fee. Like, the individual mandate, I didn't have as much of a problem with it because, yes, you're required to buy healthcare, but at least it has to meet a certain standard. It has to actually cover your treatment. But now, if they actually do try to push something through with these standards removed, and in addition to that, they still have that, they can charge you, in addition to everything else, they can charge you a 30% higher rate for a year if you go without health care. Then, now you are, in effect, you're still being forced to buy insurance unless you want to pay the higher rate. But now you don't even know if it'll even cover what you need it to cover. This is, again, it's disgusting. And the fact that any single person, honestly, the fact that any person who's voting in favor of this or is against it because they want it to be an even deeper cut or to gut the Affordable Care Act even more, they should not be even viable as a candidate next election. Like, it's sick. So, all right, well, that concludes today's rant, at least. I'm going to try to get a couple more things done, so, see you next time. Like, dislike, comment, subscribe, whatever. Links will be in the description. Bye.